are allowing the private sector immediately to open the buying of COVID vaccines, anti-COVID vaccines, baski saan sila makakuha. Because ang ating gobyerno, yun lang rin ang binigay sa atin, limitado. Something has gone wrong in most of the countries. They Shanghai, yung parang kinuha na nila na sa kanilang gobyerno. At ewan ko, there's a rocos now somewhere in we are not allowed to mention the name of the countries, but there's something, there's a rocos going on, and the fight for COVID possession is ongoing. It's a very serious one. But before that, let me read ang klaseng quarantine ang naka-impose sa places, local governments na naghihigpitan. I'll start by reading the places that are under enhanced community quarantine. Kagaya yan sa una, halos back to zero tayo dito. NCR, Bulacan, Cavite, Laguna, Rizal. That is March 29 until April 4 ang kanilang subject to review. Ang modified enhanced community quarantine, ang Quirino Province, that is April 1 to 15, 2021. For this escalation of the quarantine, it will be loosened or stricter depending on the result of the surveys. Today, Metro Manila, I think, registered 10,016.
Nationwide po, sir.
10,000.
16 po.
16. Ngayon, so, bakit tumataas eh? Bakit? Patuloy pa rin yung mikrobyo na gumagana sa katawan ng tao dito sa Pilipinas. To continue the modified enhanced community quarantine, City of Santiago, Isabela. Ang general community quarantine, the entire Cordillera Administrative Region. Region 2 is Cagayan, Isabela, Vizcaya. Region 4A, Batangas. Region 8, Tacloban. Region 10, Iligan City. Region 11, Davao City. Ang Barn, kasali ang Lanao del Sur. Dito tayo sa modified general community quarantine. Well, it is for the rest of the country. So aside from those countries, the places that I have mentioned, yun yung mga istrikto. Itong the rest of the Philippines, modified general community quarantine lang. Now, bakit ganon? Ang gobyerno ba natin nagkulang? Ang gobyerno ba natin walang ginawa? Alam mo, sa totoo lang, ang naka-lockdown ngayon, ang the countries of Ukraine, France, Germany, Poland, Italy. 75% of Italy has entered a new lockdown in a bid to fight the rising rates of coronavirus. Hindi lang tayo. Nauna na lang sila nga sa vaccine. And yet, itong may bagong strain, I'm not a doctor or a medical practitioner. Pero may mga reinfection sila at may bagong strain at ito yung tinatakutan ko. Now, ito sa atin, kanina galing ako airport, may dumating na 1 million sinalubong ko. Lumipad ako galing Davao. Tapos, just in time, nandoon yung aeroplano, PAL, which was leased by the government precisely to bring in the 1 million. Ang sunod na delivery natin is 2 million. Pero wala pang siguro yan. Dito sa mga countries na ito na sinasabi ko, nag-aagawan sila. I cannot name the countries because I was warned not to mention them. Nag-aagawan sila ngayon at ang sabi ko, hinold ang hinold. Dapat sabihin yan kasi para malaman rin natin na how unfair it is really, especially if you are on the side of the poor, na yung ma-hold yung bakuna. So, wala man tayong magawa. Akin ang decision is I have ordered Secretary Galvez to sign any and all documents that would allow the private sector to import at will. Baski ilan ang gusto nilang ipasok. Okay sa akin. Tayong gobyerno, ito lang ang nakuha natin, ito lang rin ang binigay. Well, of course, hindi natin masabi na mas marami ang mabili ng private sector. But dito sa Pilipinas, maraming mga negosyante na gustong bumili kasi ibigay nila sa kanilang mga trabahante. You know what is the reason? Do you know the reason why? So that the economy can be opened. Yung mga factories nila, walang trabahante. Because itong karaming restrictions sa mobility ng tao. There are so many strict restrictions and workers come from all places. So it's hardly doubly hard for government really to alam mo itong teka muna ha. Let me give you this warning. Pati magprangkahan tayo. Itong dumating ngayon na 1.2 million, para lang ito, tamang-tama lang ito, sa mga frontliners, sa mga health workers, at yung lahat ng may connection doon sa trabaho in fighting COVID. Ang gusto ko lang malaman, Secretary Galvez, itong mga, for example, medical people but who are not at all doing work in a hospital or mga practitioners yan, yung hindi talaga may ibang negosyo, not the practicing ones, should they be considered also ordinary civilians? Kung ako, hindi ko ibigay kung Kasi kung hindi naman connection with your job, meron mga tao na hindi, medical ang edukasyon. Medicine, nursing, pero hindi na pinagpa-practice. They are not practicing their profession. Would it be considered also priority or just an ordinary citizen who should be in line doon sa priority?
Tama po kayo, Mr. President. They will not be considered as healthcare workers for the simple reason, sir, na yung risk exposure nila halos wala compared to the healthcare workers in the hospitals, both local and national, both public and private po, at mga iba pang mga facilities, ang ating pong mga isolation quarantine facilities, yung pong ating mga barangay health workers, yung ating pong mga doktor sa mga AFP, PNP, yan po talaga kasama po yan sa A1 at sila po yung binibigyan natin ng prioridad. Ngayon, kung doktor na hindi naman nagpa-practice, halimbawa, negosyante naman sir, walang risk exposure in the same manner that healthcare workers who are actually working in the healthcare facilities are exposed. Yun lang po. Tama po kayo, Mr. President. They will have to be considered as part of the general population and must follow the pecking order in the prioritization, sir.
Just be on the reasonable side. Kung ano lang yung reasonable. Kung hindi ka naman talaga exposed sa anong klaseng mikrobyo because you have not visited any clinic or hospital, then you should be considered an ordinary person and last in the priority of people would get the vaccine early.